Fasting can have both positive and negative effects on the eyes of people with diabetes. Here are some possible effects. 1. Improved blood glucose control. Fasting may help people with diabetes better control their blood glucose levels, which can help reduce the risk of diabetic eye diseases, such as diabetic retinopathy. 2. Dehydration. Fasting can cause dehydration, which can lead to dry eyes and worsen diabetic eye symptoms. 3. Hypoglycemia. Fasting can increase the risk of hypoglycemia, low blood sugar, in people with diabetes, which can lead to vision problems, including blurry vision and difficulty seeing. 4. Ketosis. Prolonged fasting can lead to ketosis, a metabolic state in which the body uses ketones for energy instead of glucose. Ketosis can lead to a buildup of acidic compounds in the blood, which can be harmful to the eyes and other organs. 5. Nutrient deficiencies. Fasting can result in nutrient deficiencies, which can negatively impact eye health. It's important for people with diabetes to talk to their healthcare provider before beginning any fasting regimen to ensure they can do so safely and without any negative impact on their eye health. Let's talk about the intermittent fasting benefits. Intermittent fasting is a dietary pattern that involves cycling between periods of fasting and eating. There are several potential health benefits associated with intermittent fasting. Weight loss. Intermittent fasting can help with weight loss by reducing calorie intake and increasing metabolism. Improved insulin sensitivity. Intermittent fasting may improve insulin sensitivity, which can help lower blood sugar levels and reduce the risk of type 2 diabetes. Reduced inflammation. Studies suggest that intermittent fasting may help reduce inflammation in the body, which is a risk factor for a variety of chronic diseases. Improved heart health. Intermittent fasting has been shown to lower blood pressure and cholesterol levels, which can reduce the risk of heart disease. Improved brain function. Some studies suggest that intermittent fasting may improve cognitive function and protect against neurodegenerative diseases like Alzheimer's and Parkinson's. Increased lifespan. Animal studies suggest that intermittent fasting may increase lifespan and delay the onset of age-related diseases. It's important to note that intermittent fasting may not be suitable for everyone, particularly people with certain medical conditions or a history of disordered eating. It's important to talk to a healthcare provider before starting any new dietary regimen. What is the relation between fasting and insulin resistance? Fasting can potentially help improve insulin resistance. Insulin resistance occurs when cells in the body become resistant to the effects of insulin, a hormone that regulates blood sugar levels. This can lead to high blood sugar levels, which can increase the risk of type 2 diabetes and other health problems. During fasting, the body starts to break down stored fat and glycogen for energy, rather than relying on glucose from food. This can help lower blood sugar levels and improve insulin sensitivity. Several studies have shown that intermittent fasting can improve insulin resistance and blood sugar control in people with type 2 diabetes. For example, a study published in the Journal of Diabetes Research found that intermittent fasting improved insulin sensitivity and decreased blood sugar levels in people with type 2 diabetes. However, it's important to note that fasting may not be suitable for everyone, especially those with certain medical conditions or a history of disordered eating. It's important to talk to a healthcare provider before starting any new dietary regimen. Additionally, people who take insulin or other diabetes medications should be monitored closely during fasting to prevent hypoglycemia, low blood sugar. Keto diet and diabetes. The ketogenic diet, or keto diet, is a high-fat, low-carbohydrate diet that has gained popularity in recent years. Some studies suggest that a ketogenic diet may be helpful for people with diabetes, although more research is needed to fully understand its effects. Here are some ways that a keto diet may impact diabetes. Improved blood sugar control. By limiting carbohydrate intake, a ketogenic diet can help lower blood sugar levels in people with diabetes. This can help reduce the need for diabetes medications and may even put some people into remission. Weight loss. The keto diet can help with weight loss, which is important for people with type 2 diabetes, as excess weight can contribute to insulin resistance and high blood sugar levels. Increased ketone levels. The keto diet causes the body to produce ketones, which can be used as an alternative energy source to glucose. Some research suggests that ketones may have neuroprotective effects and could help improve cognitive function in people with diabetes. However, there are some potential risks associated with a keto diet, especially for people with diabetes. The high fat content of the diet can increase the risk of heart disease and other health problems, and it can be difficult to maintain over the long term. It's important to talk to a healthcare provider before starting a ketogenic diet, especially if you have diabetes or other medical conditions. They can help you determine if the diet is safe and appropriate for your individual needs, and can help monitor your health as you make dietary changes.